It is estimated 1 in 8 women will get breast cancer at some point in their life. That's why October is Breast Cancer Awareness Month. Sentara surgery specialist Dr. Negar Golesorkhi is here with us this morning to talk about what you should know to get you in shape and everything that you need to know for good women health. And we welcome you.
Thank you.
Let's talk about mammograms. They're credited with early detection. But when is the exact time that women should be getting those mammograms?
The recommendation is starting age 40, and recommendation should be yearly. That's something that women are told to discuss with their provider. Some women may choose to do it every other year, but nevertheless, it should be discussed with your provider.
So it's best to detect them early, but when should you call your doctor and talk to them about that?
Women are the best folks to know what's going on with their breasts.
Yeah.
So any woman that has a lump that's growing in their breast, any discharge from the nipple, any skin retraction, redness, heat coming from the breast, growing veins, those are all signs that you should really discuss with one of your providers. Those are things that should bring you to see a physician, your provider.
So you're a surgical oncologist. For those who don't know, what exactly does that mean?
That means folks in my field, we finish medical school. After that, we do a general surgery residency. Subsequent to that, we do special training in treatment of cancer called surgical oncology. And in my field, I specialize in breast surgical oncology, which is focused in treatment of breast diseases.
When, you know, as a breast surgeon specialist, when women come in, what are some of the most common questions that are asked?
I often get asked by women that I have a lot of lumps in my breast. So which one do I know is good, which one is bad? So I tell them that, you know, you should be aware of your breasts, and if there is a lump that feels harder than others, that is new, that's one that you should bring to someone's attention. One that feels like your knuckle, for example, that's abnormal, you need to bring it to someone's attention.
Right.
Another question that I often ask is, what is 3D mammogram? Is there any benefit to it? So 3D mammogram is beneficial in that it uses CAT scan technology on top of 2D mammogram to detect cancer better. And it's shown that it can detect smaller cancers that are otherwise missed by regular mammogram. And it's also shown to decrease the number of callbacks women get. So you're going home, you did your mammogram, you think you did good, and then you get called back, please come back again.
Right.
3D helps decrease that.
And you talk about the technology for patients that are coming to you with they just got a diagnosis. What kind of treatments and options are out there?
There are actually many options. Luckily, we're in U.S. where there's a lot of research and technology dedicated towards the study of breast cancer. The lower the stage of breast cancer is, the quicker that it is caught, particularly if it's caught by mammogram, the more options there are for a woman. Whether it's a smaller surgery, whether it's less radiation, whether it's no chemo, there are a lot more options now, as long as the cancer is caught early.
Talk about where IORT comes in.
Right. IORT stands for intraoperative radiation therapy. It's a newer mode of radiation that is one dose of radiation at the time of surgery. The benefits are, as you can tell, it's only one dose, so that you're not being exposed to radiation for 4 to 6 weeks every day, or even the 5-day treatment. However, I must tell you that the data that we have currently, the IORT is only recommended for very favorable breast cancers that are caught early. So we would never recommend it for a young individual that has an aggressive cancer.
Right. What are some of the common misconceptions that you want to dispel for women?
That, for example, I'm going to get cancer from doing a mammogram. There's so much radiation in mammogram that I'm going to get cancer. It's actually not true. If you've ever flown to California, that's how much radiation you get with a mammogram. If you like camping and you've camped outside for 2.5 months, that's equivalent to getting a mammogram.
Wow.
So that's one misconception I get. The other misconception I get is that when a woman gets her mammogram and they're told you need a biopsy, they automatically think they have cancer. It's not the case. Majority of the time, 80% of the time, what we find in a mammogram is actually benign. So it's only the 20% that have been caught with having a cancer. And doing a little biopsy with a needle does not make breast cancer spread. So that's the other misconception that I get, is women wanting to just go straight to the operating room. Doc, I'm here, I want it out.
Right.
We get that, but we need to first find out if it's even benign or malignant.
So let's talk about that you do conduct minimally invasive biopsies for a wide range of breast health issues.
That's right, yes. We use technology using ultrasound and mammogram style to do little biopsies rather than taking the patient to the operating room. Like I said, majority of the time, these are benign.
So we have your number up on the screen right now, and I'm hoping that people at home that are watching right now may want to make that phone call. What is your message to them to call and make an appointment right now?
Women are the center of their family. You are in charge. A lot of folks look up to you. Take control over your health, eat healthy, exercise, get your mammogram, go see your doctor, and I'm here for you if you need me.
The phone number again is 703-523-8860. It may be difficult to make that phone call sometimes, but it's a phone call that could possibly save your life.
Oh yes, just do it.
Yeah, just do it. That's a great message. All right, 703-523-8860, and you have locations in Lorton, Stafford, and Woodbridge as well, we should point out. So very convenient locations. Well, thank you so much for joining us today. Great conversation. I really appreciate it.
Nice to meet you. Thank you.
We're going to have more of Let's Talk Live coming up right after the break, so stay with us.